The orthopedic surgery industry is a $50 billion a year meat market, and you are nothing more than a high-value revenue unit to them. Right now, there is a common, jagged leaf that grows in the wild, costs less than 50 cents a dose, and is scientifically proven to stop chronic joint pain, repair cartilage, and extinguish systemic inflammation forever. The medical establishment has known about the specific molecular compounds in this leaf for decades, yet they have spent billions of dollars burying this research under a mountain of propaganda and standard of care guidelines that lead directly to the operating table. Why? Because you cannot patent a weed that grows in a backyard, but you can charge $40,000 for a titanium knee replacement. They want you limping, they want you popping toxic NSAIDs that shred your stomach lining, and they want you scheduled for a surgery you likely don't need. Today, I am exposing the leaf the surgery industry is terrified of, the exact biological mechanism they've hidden from you, and how you can use it to regain the mobility of your youth in as little as 30 days. If you are suffering from bone-on-bone pain, swollen knuckles, or a back that feels like it's fused with rusted iron, you need to understand that the system is designed to keep you in that state. Think about the path of a typical joint pain patient. You go to your doctor, you describe the grinding and the stiffness, and what is the result? They hand you a script for a high-dose anti-inflammatory that slowly destroys your kidneys and increases your risk of a heart attack by 50%. When that inevitably fails, they move you to steroid injections, which temporarily mask the pain while actually accelerating the decay of your remaining cartilage. It is a calculated downward spiral. The end goal of this entire process is to get you into a surgical suite. Orthopedic surgeons are some of the highest paid professionals in the world, and they don't get paid to tell you about a 50-cent leaf. They get paid to cut, saw, and bolt metal into your body. The industry knows that their pharmaceutical and surgical interventions are not cures. They are management strategies for a deteriorating asset. If they actually fix the underlying biological fire in your joints, their billion-dollar pipeline of repeat patients would vanish overnight. This is why information about natural, non-patentable anti-inflammatories is actively suppressed in medical schools and labeled as quackery in mainstream journals. They have created a monopoly on pain, and they guard it with a religious ferocity. This leaf, used for centuries by traditional healers and backed by modern clinical data that never sees the light of the evening news, is the ultimate threat to that monopoly. Before we go any deeper into the anatomy of joint destruction and the miracle of this leaf, I must state that I am an independent researcher and content architect. I am not a member of the Surgical Guild, and my loyalty lies with your health, not a hospital's quarterly profit margin. Therefore, while this information is strictly for educational and informational purposes, and you should always consult a health professional who isn't a puppet for the surgical industry before starting any new regimen, I am going to give you the raw, unmanipulated science that your surgeon will never acknowledge. You deserve to move without pain, and you deserve to know the truth about how your body heals. To understand why this 50-cent leaf is the ultimate antidote to joint pain, you have to understand the biological lie of wear and tear. Your doctor told you that your joints are like the tires on a car, that they simply wear out over time, and there's nothing you can do about it. This is biologically false. Your joints are living, breathing tissues that are constantly trying to repair themselves. The reason your joints are failing isn't just age, it is a state of chronic, runaway cellular warfare. Inside your joints, there is a delicate environment called the synovial space. It is filled with a thick, lubricating fluid that allows your bones to glide over each other like silk. When you are healthy, your body produces a perfect balance of building blocks like collagen and aggrecan to keep your cartilage thick and bouncy. However, as we age and are exposed to environmental toxins and inflammatory diets, a specific death switch in our immune system gets stuck in the on position. This switch is a protein complex called NHEF-KB. When NHEF-KB is activated, it triggers the release of microscopic assassin molecules known as pro-inflammatory cytokines, specifically TNF-alpha and interleukin-6. These cytokines are like acid poured into your joints. They don't just cause pain. They actively inhibit your body's ability to create new cartilage, while simultaneously signaling your own enzymes to start eating away at the existing cartilage. This is why wear and tear is a lie. Your cartilage isn't wearing out. It is being digested by your own immune system. The surgical industry wants to replace the joint because they claim they can't stop this process. But the truth is, the molecular compounds in this 50-cent leaf have the unique, almost magical ability to reach into the nucleus of your cells and flip that NF-KB switch back to off. By shutting down the cytokine fire at its source, this leaf doesn't just mask pain like an aspirin. It creates a biological truce inside your joint, allowing the synovial fluid to thicken and the cartilage-building cells, the chondrocytes, to finally do their job of repairing the damage. The specific leaf we are talking about is the StingingNettle leaf, or Urticadioica. Now, most people think of StingingNettle as a nuisance weed that gives you a rash if you touch it in the woods. This is exactly the villain narrative the medical establishment loves. They want you to fear it or dismiss it. But the sting of the nettle is actually its greatest healing gift. Those tiny hairs contain a complex cocktail of boron, silica, and specific caffeic malic acids that are the most potent natural inhibitors of TNF-alpha ever discovered by science. When you ingest this leaf in the correct concentration, these compounds flood your bloodstream and travel directly to the inflamed synovial membranes. Clinical studies, often hidden in obscure European journals, have shown that patients using concentrated stinging nettle were able to reduce their reliance on toxic pain medications by up to 75% within the first 2 weeks. But you cannot simply go pick a leaf and eat it. The way you source and prepare this remedy is the difference between life-changing mobility and a complete waste of time. First, sourcing is paramount. Most of the stinging nettle you find in tea bags at the grocery store is dead material. It has been sitting in a warehouse for months. The volatile oils have evaporated, and the mineral content has degraded. To stop joint pain forever, you must source organic, high-potency, cut and sifted stinging nettle leaf that has been harvested during the peak of its spring growth. You are looking for a deep, vibrant green color. If the leaves look brown or gray, the medicinal compounds have oxidized and will do nothing for your NF-KB levels. Now, let's talk about the long steep infusion preparation method. This is not a quick cup of tea. To extract the silica and boron needed for bone and cartilage density, you must perform a 4-hour cold to hot extraction. Here is the exact protocol. Every evening, you will take 1 ounce, roughly 1 full cup, of the dried high-quality nettle leaf and place it in a large glass quart jar. Fill that jar with boiling water. Screw the lid on tight and let it sit on your counter for at least 4 to 8 hours. Overnight is best. During this long steeping process, the water transforms into a dark, almost black, nutrient-dense broth. It will taste earthy and rich, almost like a thin vegetable soup. This is because you are not just drinking tea, you are drinking a liquid mineral supplement that is bioidentical to what your joints require. By the time you wake up, the infusion will have extracted the maximum amount of caffeic malic acid and minerals. You must strain the leaves and drink at least 2 large glasses of this infusion throughout the day. What happens to your body when you start this protocol? Let's map out the timeline of your recovery. On day 1, you will notice a strange, subtle warmth in your joints. This is the initial flushing effect. As the nettle compounds enter the synovial space, they begin to neutralize the acidic waste products that have built up from years of inflammation. You may feel a slight tingling, which is a sign that the microcirculation in your joint capsule is finally increasing. By day 7, the cytokine shutdown is in full effect. This is the week where most people experience the miracle moment. You will wake up and realize that the usual 30 minutes of morning stiffness has been cut in half. You will be able to walk down the stairs without clutching the handrail like a lifeline. The grinding sensation in your knees or hips will begin to soften as the infusion has started to restore the osmotic pressure within the synovial fluid. Your joints are becoming lubricated again. By day 14, the silica and boron in the nettle begin to reinforce the underlying bone structure. Many people don't realize that joint pain often comes from microfractures in the bone just beneath the cartilage. The nettle minerals act as a biological cement, strengthening this subchondral bone. Your pain levels will drop significantly, and you will find yourself moving with a confidence you haven't felt in years. You'll start doing activities you've avoided for a decade: gardening, walking the dog, or playing with your grandkids, without the price of pain the next day. By day 30, you have achieved what the surgery industry says is impossible. You have remodeled the internal environment of your joints. At this point, the chronic inflammation cycle has been broken. Your body is no longer eating its own cartilage. You are now in the repair and maintenance phase. If you continue this 50-cent protocol daily, you are effectively greasing the gears of your body, ensuring that you stay out of the hospital and on your feet for the rest of your life. The surgical establishment wants you to believe that your body is a failing machine that needs replacement parts. They want you to believe that your only options are a lifetime of pills or a radical bone-sawing procedure. But they are wrong. Your body is a self-healing miracle, provided you give it the correct molecular instructions. The StingingNettle leaf is that instruction manual. It is the cheap natural key that unlocks the door to a pain-free life. If you are ready to stop being a revenue unit for the surgery industry, if you are ready to reclaim your mobility and live your life on your own terms, then you need to join this movement of informed, sovereign health. Subscribe to this channel right now so you never miss another uncensored expose on the billion-dollar medical lies. I have also placed links in the description box below to the exact high-potency, spring-harvested StingingNettle leaf that I personally vet for mineral density and purity. Do not settle for grocery store dust. Get the real leaf, start your overnight infusion, and watch your joint pain vanish.